Let's talk about what's going on with the GoodRx partnership, because you can see that is sending shares absolutely flying this morning. What does this mean for Novo? What does this mean for GoodRx?
I think it's seen, on the backs of this Wegovy approval last week that happened late on Friday. Novo has had a rough start to the year, and this is sort of the good news that they needed to get investors excited again about what the company is doing. It's been losing out a bit to Eli Lilly's drug Zepbound. And so what this really shows is that Novo's trying to get back into the market. They are making some strategic moves to, one, get their drugs to more patients, two, sort of this I'm thinking of it a little bit actually as like a 1-2 punch. We've seen the Trump administration wanting to lower drug prices, asking companies to lower their drug prices. And so sort of on the heels of that, we are seeing Novo come out and say, Ozempic, which is probably the most best-known drug right now, we're going to lower the price for cash-paying patients. At the same time, fighting off some of the competition, both from Eli Lilly and from the compounders that have been eating away at their sales.
It's still not very low. I just want to remind everybody, it's still at $500 a month. If you're on the maximum dose of 2 milligrams per injection, that's like $65 per milligram, and gold costs 10 cents per milligram.
Thank you.
So the compounders, I guess, are the better comparison, right? I'm seeing on my Instagram feed $119, $99. Now, these may be for smaller doses, right? And it's a compound, not the brand name drug. But can they really fight them off with, still the cost of like a nice Hyundai car lease?
Right. It's interesting because patients who are on Ozempic is Novo's diabetes drug. Wegovy is the obesity drug. And there isn't really as much of a cash pay market for diabetes drugs, because if you have type 2 diabetes, your insurance, and you are on insurance, it's usually going to cover Ozempic or another diabetes treatment. So this move, Novo said, I think they said that there's like 98% coverage for Ozempic already. So there aren't that many patients who aren't able to get Ozempic, and $500 a month is still a bit expensive when you have insurance coverage for the drug. So they just, I think, are trying to expand availability as much as possible so patients, no matter what, can go and get the real, authentic, FDA-approved Novo Nordisk medicines compared to the compounded drugs.
And when it comes to expanding access, talk us through how this is maybe similar, how this is maybe different from what Novo is already doing with the likes of CVS, for example.
Exactly. So Novo already launched cash pay, cheaper Wegovy back in March for the same price, and they have deals with CVS to allow customers who go to purchase their drugs at CVS to get these drugs for $500 a month. They also offer those cash pay drugs through NovoCare, which is their cash pay pharmacy. And they have partnerships with companies like Weight Watchers, where people who go through Weight Watchers can get Wegovy for $500 a month already. And so this is the first time that they're launching this cash pay version of Ozempic for the same price. And they're also expanding that partnership, the partnership that they have to GoodRx.
And, at the start, you mentioned the comparison between Novo Nordisk and Eli Lilly. You can see that really starkly when you take a look at shares over the past year, over a year-to-date look here. When we think about that sort of duopoly that they have over the GLP-1 market, I have to imagine that Novo is doing all that it can to close that gap, and that the news that we got this morning, also the news that we got when it comes to being approved for liver disease as well, will probably help close it.
Exactly. Yeah, Novo is clawing its way back into the race with Eli Lilly. Lilly has had a not so great couple of weeks. Investors were disappointed about their obesity pill or orforglipron, some of the late stage data that we got recently, whereas Novo's had some better news over the last week or so. And so, they're neck and neck right now. They're continuing, both of them, to do everything that they can to stay ahead and keep their edge in this obesity race. It's expected to be a $95 billion market by 2030. So there's a lot at stake here. And right now, it seems like Novo's having a good week. They have a new CEO in there. And so some of these moves also might be him sort of trying to make his mark early, but we'll see.